Hi everyone. So today we're going to talk about a few different menstrual cup folds. I've been using a menstrual cup for about 3 years now, and my favorite fold is the punch down. But I'll step through a number of different folds for you, and you can figure out based on your body type and the angles that you prefer what works well for you and for your body. I have a fleur cup, which is a very standard cup shape. Some other ones also have a ridge that goes into the cup. Or alternatively, I've seen a number that have a wider body with a hook around the bottom for you to hook your finger through and gently tug that cup out. I'm quite happy with a stem, though some people choose to trim it. It can sort of stick out of you, but if you're comfortable, then there's no need to trim it if you don't want to. So with a fleur cup, the standard punch down fold is when you put your finger here in the middle of the cup and kind of push your finger in to punch down on it, and that creates a narrow entrance for the cup to then, when you hold it like this, push that into your vagina. So if this was your vagina here, you'd be using this to push the cup and then let go for it to open up inside you. It can be a bit painful having that open up. So one option is to just leave your finger in here with the punch down and then let go of your finger so that opens up a bit more gently inside you rather than whacking your inner vagina walls. Next, I'm going to step through the C fold. So the C fold is another simple one that's often recommended in the instruction booklets with your cup. So that's the C fold there. As you can see, it just forms a C shape. It's a bit wider than the punch down. So I personally prefer a punch down fold, but the C fold is also quite effective. So again, if that's your vagina there, then you'd be pushing that in and then sort of letting go, and that opens up inside you. An alternative to the punch down is this triangle shape that basically is folding this like a triangle. And so instead of putting your finger in the middle and punching down to form a triangle, you're just folding to form that triangle shape, and you're getting that same narrow end to go in, let go, and it opens up inside you. Yep. Those are two of the most common folds. I'm going to step through a few other ones now, just so you can try them all and figure out what you like. So this one here is called a 7, and again, that the aim of it is to try and create a narrow end to the cup, so that when you put it in, it just goes in a bit more easily compared to something that has a wider entrance. The origami fold is where you do a bit of a punch down there, but then use this to kind of roll the cup on its side, and you've got like a tulip shape like this. So that would be inserted going in like that. You could then let go of this finger to let this open up inside you. Next, we're going to do the labia fold. So what you want to do is just squeeze the top of the cup, press it down into the center, and then squeeze the rest of the cup in around it. So this forms, like, I guess, a nub in the middle. And what you'd be doing is just using this this insertion end to go into your vagina, and then use the nub to release inside you, and that will help in terms of not needing to have a finger going all the way in there to release the cup, depending on the height of your cervix. Like the 7 fold, there is also a double 7 fold. So first we're going to fold this side into the front, like so, and then we're going to get the other side and fold it slightly to the back. So that kind of forms a tulip shape like this, which gives you an easy end for insertion. Some of the more complicated folds that I personally don't think are very effective are the S fold and the E fold. So I'm going to show you both of them just for a laugh, but by all means try it if you like. So the S fold is folding the cup like so. It is actually quite hard to hold. As you can see, that forms an S shape there, but it's really wide in the shape. So if you were holding it like this and trying to put it in, as you can imagine, it would be quite hard to get in. But it works for some people, so be my guest. There is also the E fold, which like the S fold has a number of little fiddly bits. So if we punch down on both sides, imagine a double punch down, this is what that looks like. So that kind of, if you look at it this way, it forms the letter E, and so you'd be holding it like this or like that, whatever works for you. And if that's your vagina, then that's going in like this, and then you sort of let go of the E and it opens up inside you. Lastly, I'm going to show you the diamond. So the diamond is where you kind of press in the middle of this cup, bring the top down and pull it towards the bottom, and it forms this diamond shape with this on the outside. But you want to be pulling this in to complete the squareness of the diamond, and that gets held in like this. So you've got a diamond shape. Yeah. So if you were inserting that, you kind of want to hold these two bits in the middle closed like so. And so you've got this narrow end at the top there, but it's quite wide in the body. So if that was going in, I think this entrance would go in quite nicely, but then you might get stuck with that being quite wide there. And as that opens up, potentially that might sort of open up in a hurry and whack you inside. So that's the diamond fold. I also have a menstrual disc, which is a Luma disc in a small. I have only been using this for a week now, but I find it actually quite a bit more comfortable than a cup. So the way that you would insert a disc is just squeeze it in the middle like this, and then insert with this end. And because the bottom is really soft, it's a soft disc that will just open up inside you, and you don't have as much of a hard barrier there compared to a cup where you want that really narrow end for insertion all the way through. I'm just going to talk through some of my own personal tips for using a cup. This is just based on my own personal experience, so it may not work for everyone. I find that if you try a number of different folds, you'll find the one that works for you the best based on the angle of your cervix, whether you're tilted forwards or backwards. I personally have a cervix that is tilted backwards, which is just a normal variation to the way that your cervix might be tilted. So for me, the cup sits a lot lower in my vagina than it would for someone else. This means that when I am inserting it, the punch down fold is actually the best for me, and I prefer doing this in the shower or with one leg raised up on top of the bathtub edge or on top of the toilet, and it helps to sort of just breathe out while you're doing it. So the punch down is best for me. It also, because it sits lower, I have the edge sticking out a lot more. Another thing I would say would be to just focus on breathing out while you're putting the cup in. Yeah, I guess there's some sort of yoga breathing thing to do with it, but I'm not sure what exactly that is, but the breathing does help. I've also read in a number of pregnancy and labor childbirth books, especially Ina May Gaskin refers to how there's a connection between all your sphincters. So if your mouth is open, your cervix will open, and I think your vaginal sphincter also just feels more open. So if your mouth is just get loose, then your whole body is just more loose. So try and have your mouth open and just like leave your mouth loose while you're inserting it. If you're feeling tense, just take a breath, go for a walk, come back to it. Try not to put that pressure on yourself that you have to get it in on the first try. I would also say once you do get it in, to make sure that it has opened up, you can slide a finger in and just press against your vaginal wall to give it room to move and that cup to open up against it. Say the cup squished in there, you just press against the wall and then voila, it has room to open. The other thing would be just squatting and kind of just shaking your body a little bit. So there's actually a concept, I think it might be from Scandinavian countries, in childbirth, which is called the shaking of the apples, where to loosen up in childbirth, a woman would kind of just stand there and the midwife or whoever's assisting her in giving birth to her child would grab her thighs and bum and kind of just shake it. So you can kind of do this to yourself, and I find this really effective for me where I'm not sure if my cup has opened up or not. I'll kind of just squat a little bit and then just grab my thighs and just shake them around and my bum, and I feel like the cup, then I can feel it open up, and that's quite effective. So whatever works for you, let me know how you go. It does take a while to get used to the inserting and removal, so if you do have issues, just reach out. I'd hate for someone to give up because they couldn't get it in once and then they just think, oh, this isn't for me. You know, give it another go. If it's really not, then there's no harm in having tried it. But you know, there are lots of other people who do use menstrual cups and menstrual discs. So if you do have issues, there are people who are happy to help. I also find that cups have been very useful in terms of just being active and getting out and about. I've been able to leave it in for 8 to 12 hours depending on which day of my cycle, compared to other period products and disposable products where I'd need to change it more often. You save a lot of money, and I mean, I haven't bought period disposables in over 3 years now, so that's been a big win. So save money, save the environment, less mess in general in terms of day-to-day going about if you're just emptying your cup in the shower and the toilet, and just a lot more comfort and feeling secure about wearing clothes that I like wearing and not feeling like I have visible panty lines with my pad. So yeah, it's been fun. There's lots of support out there. There's lots of resources like the Put a Cup in It group on Facebook, and quizzes you can do to find the ideal cup for you. Definitely reach out if you have any issues, and there's probably other people having the same problem, so it doesn't hurt to ask. Another thing I would say to watch out for is when you go to the toilet, there is a chance that when you go to the toilet it dislodges your disc, or it may affect the suction on your cup and that releases a little bit. So when you go to the toilet, don't be alarmed if you see a little bit of blood come out, as that's just dislodged it a little bit. Once you finish going to the toilet, you can put a finger in and just check that either your disc is tucked around the rim of your cervix or the cup is firmly in place. If not, just remove it, dump and insert back again once you've given it a bit of a wash or wiped with wet wipes. So that can happen. So far I've only had 2 accidents while I've been out in my 3 years of using a cup, and both times I think it's because I haven't inserted it properly. But it's been a great life changer. It's been really comfortable and made a huge difference in me just going about my normal life without the impact of using pads and the feeling uncomfortable or messy with using a pad. Or I guess for me, using reusable products was also quite important, and making sure that I didn't have tampons going into my body was a big win. So good luck. Let me know how you go on your journey.